Yeah. Of course they do. Nobody knows. No. I say so. Yeah. At least I'm gonna have to step that way.
Is this okay for you, or just maybe what they're? Okay. You can hear me, but I just didn't want you to have to worry about water or anything. You ready? You ready? Okay. You can stay here. Okay. Hi, everybody. I'm Kate Titus from A Loyal Companion, and this is my esteemed colleague, Dr. Lisa Shubitz from the Center for Valley Fever Center for Excellence at the U of A. So we are so excited to have her back again today to talk more about Valley Fever. This time we decided to make it about mobility. So that made a lot of sense for what we do here, since we only work with mobility challenged animals. So I thought this would be a really good place to start. Dr. Shubitz has been studying cocci for over 25 years. I'm not even going to try to say the whole name of the fungus. I'll do that particularly with cocci. So I'm really excited to go through this with you today. We're not going to focus a lot on what valley fever is. I think you know what valley fever is. We're going to focus more on how it presents the body and what we can do, how it affects the body, and what you can do at home to help keep your dog moving, keep them as comfortable as possible. Will I do everything?
Yeah.
All right, you're on.
So my brief introduction to valley fever is just that we all know it's a fungal disease, or hopefully we all know. And there will be something sent out that has a link to the Valley Fever Center for Excellence's full information on valley fever. If there's anything that you're newer to valley fever and we're not covering that topic today, or if you want to brush up on anything that you have questions about the disease during this conversation, because we're going to focus on what it does to dogs that makes it difficult for them to get around and how to possibly address them. So, and keeping in mind that a lot of these that we're going to be talking about, these are the severest kinds of cases that have had really bad effects from valley fever that are going to be addressed in this kind of an environment. So to talk about the things that affect dogs, the way they feel, and how it can devastate their body, it's a systemic disease. So even if your dog has pneumonia, they have a systemic infection. They feel bad. They have inflammation throughout their body, and the inflammation does other things to cells and puts the body in a condition where their things are kind of going downhill, and they feel bad. They enter a state of hypermetabolism because they're fighting the infection. So this means that their basal metabolic needs increase, and this is in terms of nutrition. So this is one of the causes of weight loss, over and above the fact that they're not eating. This hypermetabolic state that they're in because of the infection causes them to lose weight. And one of the key things they lose is lean body mass. They burn protein in a hypermetabolic state. And any dog with a fever is in a hypermetabolic state. But frankly, any dog with a systemic infection has entered into a hypermetabolic state. So we've got the inflammation, we have hypermetabolism. And then I wanted to talk just a little bit about lethargy, which is actually one of the very, very common vague signs that dogs present to veterinarians with. Many people bring their dog into the vet because it isn't feeling well, ain't doing right, ADR, not playing. And my puppy's not playing with his ball. He's sleeping 23 hours a day, and he used to be up and chewing on my furniture all day long. So we call this lethargy in dogs. It's listed as a clinical sign. In humans, the symptom they complain about, because humans report symptoms, we observe clinical signs in dogs, is fatigue, profound fatigue. And let's switch slides. Get into this. So I work with human infectious disease specialists, and I have since I went to work for the Valley Fever Center. And one of the things that Dr. Galgiani talks about is, his patients will come in and say, I got up and I took a shower and I ate breakfast and I had to go back to bed because I just couldn't do anything anymore. So this is common with valley fever, and this kind of thing that people report, my dog doesn't want to do anything, they can't do anything, they have no stamina, go to the end of the driveway, they don't want to go for their walk, they just want to go back to the house. This lethargy or tiredness that dogs get is equivalent to the fatigue. This seems to be one of the systemic effects of fungal infection. And it can last a long time. In humans, this can go on for weeks to months, even though if you take chest x-rays, their lungs are improving, but they don't feel better, even though they are getting better. So one of the things that Dr. Galgiani told me just a couple of years ago, actually, I haven't done this very long, is that he recommends physical therapy for his patients who are on the mend, but they're experiencing shortness of breath, lack of condition, lack of stamina, sort of ongoing fatigue. And he says it helps. So this is not something that we typically think of when we talk about where a physical exercise program might benefit a dog recovering from valley fever. But if you've got a dog that seems to be recovering in a lot of other ways, but they're still just can't get their stamina back, they can't get their energy back. We'll talk about this in a second. It might be that they could benefit from some kind of an exercise program that helps to build their body back up. And I'm going to talk a little bit more about the mechanisms of why their bodies get low, or over and above the fact that we've already talked about the hypermetabolism and the inflammation contribute to the fatigue. Inflammation contributes to fatigue. Anybody who has any kind of a chronic disease can probably raise their hand and speak to that. So we're going to talk about 3 presentations of valley fever today. We're going to talk about valley fever pneumonia, okay, called mycotic pneumonia in veterinary lingo. And when people think about pneumonia, they think of a bacterial infection. And they say, no, my dog doesn't have pneumonia, it has valley fever. Well, this dog has valley fever, and it is pneumonia. It's a generic term for this inflammation and infiltration in the lung. So what makes the lungs look white instead of black, like they are over here, is inflammation. It brings in cells that don't belong there. The cells are trying to clean up the fungus, but they also cause damage while they're doing that. They produce toxic substances that break down cell structures, and you get a lot of fluid leaking into this. And contained in those fluids are the poisons that our cells use to poison the fungus. The problem is they poison ourselves a little bit too. So they release oxygen radicals, nitrogen radicals, hydrogen peroxide. These are things that are damaging. If you put them on your skin, you know that they're damaging, and now they're in your lungs, where they're a little more fragile. So we've got all of this going on here, and this makes it look white. You've got cells and fluid in a place where they don't belong, and it's supposed to be air. And this is a consolidated left upper lower lung lobe. Get that? Okay, it's got two lobes. So anyway, and this is pneumonia. This dog has coughing, may have shortness of breath, maybe breathing hard and rapidly, and it can take a very long time for this to resolve. It might resolve quickly, but in some dogs, this can take a year to completely clear out. And some dogs may recover from this really quickly and feel better, and the owner comes back in 2 months and goes, yeah, my dog's running around feeling great. Others may really struggle to get over this. And these kind of dogs might benefit from some physical therapy. So the next thing we're going to talk about is bone disease in valley fever. And there's several things that I want to point out. So this is a dog that has valley fever in the vertebral body. Okay, you see this fluffy white stuff coming out. It should be nice and smooth like it is here. This is inflammation, again, and it's making bone, and it's putting out cells, and this is painful. It also is impinging on the spinal cord up here. So this dog has a little bit of neurological involvement and lots of pain, but this is putting some pressure on the spinal cord. And this is relevant to one of the other slides that we're going to talk about as well. This dog has a bone lesion in the upper part of the femur. So this is basically his hip bone. And it's extending all the way over to here. And this is probably all valley fever in this dog. It's hard to tell whether there's an element of degenerative joint disease in here, but I think this is all the fungus in this dog. But he feels like a dog with hip dysplasia. His hip really hurts because this is going all the way up here and causing inflammation in his hip as well as the bone. So this dog's in a lot of pain. And what happens is they're painful, they're offloading, and it's really easy for a dog to offload because they have 4 legs. Offloading means that, you know, they're running around and they may not even necessarily look like they're limping, but they're using this as a balance post. And they're not bearing weight on it. So they atrophy on this muscle. And what this does is it weakens the structures around the hip joint, and which can lead to more discomfort. So the problems that we have to address, keeping in mind, let's assume we're addressing the fungus with antifungal drugs. But the other problems we have to address for these dogs are their pain, because these lesions are painful, and some of the things they do create more pain, the muscle atrophy, and mobility. If this dog has neurologic symptoms and is having difficulty rising, his back hurts, and his legs aren't working quite right, and this, by the way, was 170 pounds, they're having trouble getting up, okay? And this dog here may be packing this leg at this point. He's running around on 3 legs and carrying it. But when this dog lies down, this dog also is having trouble getting up. They're going to shift everything to the other side and put more weight bearing on the other side and things like that. So we have to address the mobility, the muscle loss that they get from this, and the pain that they're experiencing. Obviously, the pain part needs to be addressed probably mostly by the veterinarian. And this is a very interesting and bad case, as you can see. And this dog has a terrible infection of the pelvis. So this dog's in constant pain. This dog's back hurts. This dog's pelvis hurts. This dog's legs hurt. And she had lesions in the forelimb also. This is a typical dog that comes to us from Pima Animal Care Center with valley fever. They've probably been stray, potentially neglected, or they've been relinquished by owners that know they're sick, they can't afford to take care of the dog. And this happens a lot. And all the veterinarians in Tucson probably see these patients. But the other thing this dog has, this is an older dog, this dog has probably long-term osteoarthritis from age and potentially malformed hips. So even if we can make her feel better here, we still have to deal with this right here. So the considerations for this, and you can also see that this dog has severe muscle atrophy. This has been going on in this dog for a long time. She's very thin from her disease, so she's burning protein. She's not mobile, so she's not using her muscles, and she's in a lot of pain. And the lack of muscle mass, as I described on the last slide, makes it harder for this dog to do everything and increases her pain. So in addition to treating the valley fever, we have to consider her pain and her overall physical condition. This requires multimodal pain management. This dog is not going to do all that great on carprofen alone. She needs drugs that interfere with pain receptors in addition to an anti-inflammatory, which is totally indicated. And then we need to balance pain with trying to maintain her mobility. What can this dog do with how painful she is and how advanced this lesion is? So physical therapy could help dogs like this. She's a very extreme example, but this could benefit all kinds of dogs with bone disease. Physical therapy may help improve or maintain their strength so they don't get into this kind of a situation. This is a dog that that was referred to me recently, and this is kind of an extreme case, but this dog is an example of a dog that probably needs an adaptive device for the valley fever bone lesion that's going on. There's some valley fever going on right here. The dog has what we call erosive arthritis of the carpus joints, the wrist, okay? And the middle bone on this dog has been completely destroyed by a combination of the valley fever and an immune-mediated arthritis that's going on. And this is the only joint this dog has that looks like this. This is almost always valley fever. They require immunosuppression and they require treatment of the fungus. The problem is that this, no matter what we do, this dog's going to be in pain because this is probably never going to re-ossify. So what can we do to support it? He's huge. He's not a very good candidate for an amputation because he's such a big dog and this is a forelimb. And so what probably this dog is going to get, they've already visited with Kate about this, is he's going to get some braces, some assistive devices. Because as a result of the disability in this leg, this dog's other leg is breaking down and he has hyperextension. This is a young dog. He needs that leg for a long time. Okay. And then the last situation where dogs may need help getting better because they're severely affected is if they get valley fever that's affecting their central nervous system. And there are two things that we see here. We can see, similar to the dog I already showed you with the bone, this dog has a valley fever lesion inside the spinal canal, pressing on the spinal cord. And this dog may not be in very much pain, but this dog can't use his legs. Okay, and if this lesion is in the neck, this dog can't use all four of his legs. This was a thoracic lesion, so this dog's going to have paralysis or paresis in the hind limb. And it's going to have trouble getting up if it can walk at all. But as we treat the inflammation and the fungus in this, they start to regain function, but they can need help because, again, they get a lot of muscle atrophy. They lose a lot of condition, and these dogs can look kind of funny. They look like a normal dog in the front. You get to like a midpoint of their back, and they get all skinny back there because of lack of innervation, because of the compression on the spinal cord. This dog has a gigantic lesion in the brain, and these dogs almost always come in seizuring. However, they can also have other debilitating effects besides seizures. They can come in with falling, circling, weakness on one side. And these guys sometimes need help getting their limbs and muscles working together again. once we get this under control. Some of them recover really quickly, but we're going to talk about dogs that might need some help. Jason.
Lisa, can you give us a frame of reference of where that is in the brain? So like, where's the neck? Is this a fronton or is this?
Dog is probably facing you, okay? This is like right here-ish, okay? It's not in the cerebellum, but it's in the middle part of
Slicing on the head from.
Yes, we're slicing it this way from nose to tail. But I think. Okay, so I talked about the fact that this could be in the brain or it could be in the spinal cord. Again, they're usually severe, and dogs with central nervous system disease may truly be facing lifelong suppressive maintenance therapy with an antifungal medication, so they're always going to need that. They have an initial requirement for steroids, which is going to be our next topic. And then the other thing these dogs with seizuring and severe inflammation in the brain are dealing with is they're on seizure control meds. And these drugs can make dogs lethargic, overweight, and somewhat ataxic. And a lot of them adapt, but it kind of depends on how well their seizures come under control, whether they need more seizure meds or less seizure meds. Most dogs with valley fever are actually able to get their seizure meds gone over time. So they may need help to begin with. Okay. Then I want to talk about steroids because steroids may be necessary. Did it change? There we go. Okay. So steroids might be necessary to treat dogs, usually in the early stages of when this disease is very bad. Dogs with seizures need steroids. We must shrink that inflammation rapidly to stop this electrical discharge in their brain. And the only way to do that is give them a steroid. The reason why in the brain, there's nowhere for the inflammation to go. It can't swell like a thing on your leg. If it swells, it's crushing brain cells. So we're losing brain with the inflammation. So we treat brain inflammation with steroids. Some dogs with lung disease come in with severe respiratory distress. They're having terrible breathing effort. Sometimes the lymph node in their chest is so big they can hardly get air past their airway because of the lymph node in the middle of their chest. These dogs usually need steroids for short term. I have, however, treated dogs that are poorly responsive that need steroids for months and months, usually at lower and lower doses. But the steroids have side effects, even at relatively low doses. And then the third one is the spinal cord disease that we talked about. Because again, it's compressing the spinal cord. There's no place for it to go. And compressed spinal cord cells die. So if we want that dog to be able to walk again and not lose their function in back, we need to use the steroids to suppress this while we're waiting for the antifungal medication to do the job. And I have had a few cases over the years where the disease was really bad, and even with steroids, these dogs experience permanent neurological disability. These dogs need help. They need assistive devices. They need mobility appliances that Kate's going to talk about. One dog was paralyzed in her hind legs. It was too bad. She was a little baby puppy, though she had a great life. Another one that is a client of Kate's and is a dog that we've worked on for years. She has ongoing neurodegeneration at the site where the valley fever was. And she needs more and more help over time. I haven't seen her in quite a while because the valley fever is not really an issue anymore, but the degenerative cord disease has truly diminished this dog's quality of life. So the bad part about steroids, now that we've talked about the good parts, is that they do have effects on metabolism. They change blood sugar management and cause hyperglycemia. They cause muscle wasting. Because of this change in metabolism, the dogs start burning their lean body mass and laying down fat, And this isn't because you're feeding the dog, you know, chicken fat and whatever. This can happen to a dog on anything. It's because of what the steroids do. And it causes muscle wasting because of this protein burning. And they get fat. They often gain, they may come in really skinny, but they start to gain weight. And once they're gaining the weight and they get overweight while they're taking the steroids, it's very hard to get the weight off. And if you've got a mobility challenged dog, it's very hard for them to be overweight. And then the side effects that you may witness with your dog on steroids, besides these sort of big things that occur over time, they want to eat all the time. They're really thirsty. And this is direct effects of the drug. So they have increased pee. You see weight gain and weakness. Weight gain and weakness. This isn't very good for a dog that, say, already got weakness and partial paralysis in the hind limb. You may see excessive panting as a side effect of the drug, and possible exercise intolerance, which may be able to be addressed by some of the physical therapy things that Kate is now going to discuss.
Okay, so one of the big challenges that I see, and you know, based on where we live, I see a lot of dogs who have valley fever. In fact, I see some folks in the audience who work with your dog because they have valley fever. It's important, I think, to understand what happens inside the body when the dog stops moving. So it's not necessarily just what the valley fever, the fungus is doing, the impact on the body, but it's what the lack of motion, the lack of movement is doing to the body. So we kind of see this in 4 different places. Most obviously, we see it in that physical breakdown. So muscle atrophy, you've all heard the term use it or lose it. A dog can lose 30% of their muscle mass in just a couple of weeks. If we have anybody in here whose dog has had a CCL tear, for example, an ACL tear, and their thigh just starts to whoop, yeah, that's muscle wasting. So that's from lack of movement. Joint stiffness. So believe it or not, joints, to not be stiff, need to move. They need that movement, keeps the cartilage healthy, and it keeps the joint lubricated and healthy. So we need to get them moving, but we need to do it safely. We'll talk about that a little bit more. The more you move, the better your circulation is. It's easier for the body to get the blood where it needs to go. And if we have that circulation decreasing, that means that your healing is going to be slowed down as well. And Lisa talked a lot about bone weakness. Once you start, usually you stop losing or using those limbs or using your body, the bone density starts to decrease. So that becomes a bigger issue as well. Now, while we're talking about the physical elements of that, you also have these cycles that go along with it. And they're vicious cycles. You think about, okay, fatigue. That's a very common sign in valley fever. You have a dog who's tired. So if they're tired, what do they want to do? They want to lay around. They want to move less. So what happens then? You start to get your atrophy. The muscles get weaker. So the muscles are weaker, so it requires more energy and more effort to move. So they're tired again. So you've got this cycle that is moving them toward moving less. Okay. On the related to that is your pain. Okay, so you've also got a dog who's not only tired, but they're uncomfortable. If you're uncomfortable, you don't want to move, right? So fear is a very, very good teacher. I've taken a couple of steps. Ouch, that hurts. Guess what I'm not going to do now? I'm not going to take any more steps because that hurts. So now my joints get stiffer. They're less lubricated. So it hurts more when I move. So how many of you are stiff when you get out of bed in the morning? Yeah, okay. It takes me like an hour to be able to walk around the house. So same thing, lack of movement. We need to get the joints oiled up a little bit. So feeding off of that, you as pet parents all of a sudden don't want your dog to move because they start to show pain. They're uncomfortable. So now you start to be a little bit more overprotective. You're trying to control more of how they move. The dog feeds off of that. So now they're more fearful to move as well. So now they're going to be less willing to try, which means they're going to move less. So you can see how that cycle, it all sort of feeds off of each other. Now, the one piece that I think it gets overlooked a lot, and in fact, when Lisa and I were talking about getting this set up, I said, you know, we've got to consider the emotional and the mental piece of this as well. Because once you get dogs that haven't been moving, and I see this a lot, they start to lose confidence in their ability to move without pain. So that's going to drive them not to move as well. And you think about simple things like going from one end of the kitchen to the other to get to their water bowl. That now becomes a very dangerous trek that they're going to think twice about before they do that. So their confidence plummets. You've also got the dogs who really want to move, but now they're frustrated and they're anxious because they can't do that. And those are two bad emotions to put together, primarily because they don't know what's wrong. They don't understand why they can't do it. They just know that when they try, it hurts. And now I'm just mad. I'm just angry and I'm frustrated because I can't move and I can't do the things I want to do. So then you start to see behavioral changes. So now they get irritable. Now they start barking more. Now maybe they're a little annoyed with their pack mate who's come over to check on them or wants to play. And now instead of engaging, they snap or bark at them to get them to go away. So now they've basically pushed everyone in the house away. So now they start to get depressed because now you don't have that input that they had been getting when they were moving to be with family in different parts of the house, following you from place to place. Now they start to lose that and their world starts to get really small. That's when we get into what's called shrinking world syndrome, where what they experience is now just, maybe it's four walls, maybe it's just the patio. The new and novel scents and smells and experiences, those are now few and far between. So that becomes a bigger challenge, I think, than what anybody really realizes. And then finally, to add insult to injury, we're looking at secondary conditions. So if you've got a dog, and we've dealt with quite a few of this. We had one come in from PAC. Her name was Daisy, white pit mix. They had to carry her in on a stretcher because all she could do was lift up her head, and that took some effort. She has valley fever in her bones, both femurs, both tibias, her elbows, and some in her spine. So she wasn't moving around a lot. And of course, she had muscle wasted. Her body had been cannibalizing the protein. So we had to be really careful about bed sores with her. Had to be flipped a lot because so much pressure being on those bony prominences on the skin, you have to watch out for the pressure sore. The arthritis starts to kick in because you aren't moving those joints. They're not properly lubricated. The other one that we don't often think about is gut health. Circulation is important for gut health. So, and then you add on top of that the valley fever medications. Sometimes there may be an antibiotic involved if we've got some sort of another infection that maybe came from a pressure sore. There's all kinds of things that are just cascading off of this just not moving. Okay, so as I'm sure you're not surprised to hear, I am a big fan of safe movement supporting medicine. There are a lot of reasons why. A couple of big ones are going to focus on the immunological benefits. Being able to perform moderate exercise is going to help support that immune system, which is going to help you fight the disease, and it's going to help the drugs work better. There's an anti-inflammatory element that comes from controlled movement that you really want to get expressed. The other piece is stress release. How many of you're stressed out? What do you want to do? You go out, if it's not 145 or so in the sun outside, you go for a walk, or maybe you go for a swim. You do something that's active. You get stress release from that. Movement also helps the body heal. So when we're talking about more cardio activities, using the lungs can actually help move some of the mucus, can help clear that from the lungs. So that's going to improve your oxygen flow. And there we're back to the weight bearing again on those bones, keeping the bones stronger, keeps them healthy during treatment. Because remember, it's usually, and correct me if I'm wrong on this, but valley fever usually presents as either osteo, or it can present as central nervous system, but it's not very common to have all of them together. It's usually one, correct?
Not common.
Not common.
Those are the kinds of things that show up at your practice.
Exactly. We get the weird ones. But we're looking at, so if we have a dog that has primarily a respiratory presentation, so it's in the lungs, may not have any impact on the joints, but doesn't feel good enough, doesn't have enough oxygen flow, doesn't feel like moving. So that's when you start to get your muscle wasting. That all comes from that. So we're really trying to use safe movement to preserve that musculoskeletal system. So keep those bones healthy, keep the muscles moving, the joints lubricated. And also the respiratory support, just the gentle walking, gentle movement can be fantastic for the respiratory recovery. Okay, let's talk about functional movement. So a lot of what we do here at a Loyal Companion is focused on functional movement. So anybody know what ADLs are? Activities of daily living. Yeah, I think if you're over 70, you know what an ADL is. So we're looking at things like being able to transition from one position to another. So from a stand into a sit into a down, to be able to get up, walk across the floor, go get a drink of water, to be able to stand to eat and drink. These are very similar to and the concept came from the human world. So we're talking about dogs are not going to dress themselves, but they are going to try to groom themselves. They do have to posture to pee and poop. They have to be able to stay engaged with what's happening around the house. And even if they can't get up and move and follow you room to room, I bet you have a place in your house where your dog will sit. And as soon as you move, they look up. Where are you going? What are you doing? Right? They want to keep them engaged in that kind of motion as well. So when we're talking about functional mobility, we're talking about those ADLs. The goal of ADLs is independence. Independence is huge for a dog. And that's why when we're doing a lot of work on any of our mobility devices, whether they're orthotics and prosthetics, wheelchairs, even the harnesses, we're looking at ways to keep the dogs as independent as possible. And that is the goal, of making sure that we have that functional movement to accommodate and to accomplish those ADLs. Now we're going to do that by allowing them to practice with simple exercises. So if any of you have taken your dog through obedience, with the first two things you learn, sit and down, and coming back up into a stand from all of those are something that dogs do every day. So practicing those through your exercises can be great for their everyday living. Short walks, even just short walks inside the house. And with as hot as it is right now, that's what I would encourage. And we have folks, if you are lucky enough to have some shade in your backyard, go out and take a couple of laps around the backyard. Walking through the house from one end to another, just any sort of movement to get your dog consistently moving is great. Gentle stretching. Anybody do any stretching with their dogs? Yeah, so we're looking for simple things, just moving things through range of motion, how they'll let you do it. Look at me, I'm able to stand and do this. Stretching arms. You can even get them to stretch up for a treat, things like that. We want to keep those muscles not only strong, but supple as well. So some simple, gentle stretching will help with that, as well as weight shifting exercises. I think weight shifting is one of the most underrated exercises. So when I'm talking about weight shifting, I'm talking about just a gentle nudge. So they're moving from side to side, rebounding back, feeling square, staying strong on their legs. Because one thing that happens is when they start to move and maybe they're a little stiff, you get a little off balance, you got to be able to pull yourself back so that you're standing again before you fall down. Those balance exercises and weight shifting exercises are very important for that. So it's also good from a pet parent standpoint to be able to evaluate or assess how your dog is doing at home. So you're going to do that from a couple of different vantage points. One, you're going to watch those ADLs. So how much trouble are they having getting up from that down when it's time for dinner? Or when it's not time for dinner and there's no food involved, how are they getting up and down? How long does it take them to get into a sit? Do they stay in that sit very long? Some dogs that have some lower back, rear limb issues don't stay in a sit very long. They may just use it as a transfer point from a stand into a down. So how, are they limping? Or are they out of breath from the walk from one end of the house or the other? So you're watching those ADLs. Breathing is another big one. Are they panting more? Are they shallow panting? Is it deep? Is it a cough? Is it wheezing? Is it rasping? Paying attention to what that breathing sounds like, the effort that goes into doing that. And the other big one is recognizing pain. So pain can be a tough one because every dog seems to have a different combination of pain signals. And sometimes those pain signals are the same or similar to some of the symptoms that we're seeing from the valley fever. So that can be panting a lot. That can be limping is going to be another big one. So we've got some pain there. Ear set, and eye set usually go together for me. So when you don't feel good, you've got a headache, all of a sudden you start to squint. So there's a lot of effort in that. So if I were a dog, my ears would be back when I was doing that. Resistance to move, changes in behavior. When you're thinking about pain, you want to think in clusters. So if you have a dog who's sitting there panting, but they just came back from outside and it's 112, that makes sense. If that doesn't calm down after a few minutes, then we pay attention. One of the things that I would encourage everyone to do if their dog has valley fever or not is just keep a short log, just a couple of quick words, even just like a little folder that we gave you today. Today's date and heavy panting today, right after our walk, didn't stop, lasted for 2 hours. Just make notes, whatever it has to be, because those notes, those allow you to contribute to your veterinary team. Lisa's great at what she does, but she only sees your dog for an hour every 2 weeks or every month. You see that dog, if that, right? If ever, right? So you see your dog every single day. You are a wealth of information. So being able to mine that and record it and take it in, that makes you a very, very, very good client to work with.
Here, here.
Yes, from a veterinarian in the room, they want you to tell you everything that you see as much as possible. And being a reliable narrator is very helpful. That's why don't rely on your memory. Okay, write stuff down. Okay, last things, energy levels. We talked about fatigue. We talked about lethargy. How is that changed in your dog over time? And you also want to be thinking about, how hot it is. I would not expect, a dog who isn't normally super active. It's not going to be that different that they just kind of want to chill out in this heat. And I know I have a little guy, Andy. I think you saw him at the beginning. He's a bit like a greyhound. He has about 15 minutes of activity in him, and then he's asleep the rest of the time, or chilled, right?
Yeah.
So understanding what your dog does and what is different. If anyone has read a book by Malcolm Gladwell called Blink, it's all about trusting what that little voice in the back of your head is saying. That little one that screams at you when you're just about to lock your keys in your car. That one, pay attention to that one and write down what you're seeing. Okay, don't disregard that. All right, strength training. So what do we do? What do we do with this? Like I said, we talked about a couple of the exercises that we're going to look at, but from a planning standpoint, you really want to look at exercises that are simple. You want to do low repetitions and have high rest. So for example, if I say, okay, we're going to have you do 3 sets of these sit stands, but you're only going to do 3 of them. And between those sets, I want you to rest the dog for 3 minutes, 2 minutes, wherever your dog is that we talk about. So we allow them to do the exercise. They can rest, return to a comfortable state, and then we tax again. We ask them to do those exercises again. So you do not want to try to do too much, too soon, too often. Too is not going to work with a valley fever dog. It's not going to work with a lot of dogs, but it's just not going to work. Don't get greedy in what you're asking your dog to do. Okay, and you want to spread out what you do, right? So you don't want it all to be strength. You want to look at uneven surfaces. So we have all of these colorful inflated items over here. Those are all for balance work. So if any of you, how many of you have been to PT yourselves? Okay. So you know they put you on those balls, or they have you do the It seems a BOSU or anything else. It seems like, oh well, that's just not a big deal. And it's not a big deal for the first 10 seconds or so. And then all of a sudden you're like, man, I just want to get off here. This is hard. It's harder than it looks. Okay, so paying attention to how much you're asking your dog to do and in what area. So we've got our balance work, we've got some flexibility, and maybe some gentle resistance when your dog is ready for it. That could be a really gentle incline. We don't have a lot of hills here in Tucson, but just a gentle, sometimes your maybe your driveway has just a little rise to it. Working on that. We're looking for just a little bit of resistance. That will help with the core. That will also help with the rear end. Finally, we want to make sure that you're paying attention to the flexibility and the comfort for your dog. So some massage might be helpful. In fact, we saw that's Mandy, who had significant valley fever. She came to see me probably every week for almost 7 to 9 months until we got her an adoptive home. She was much more comfortable. It was certainly helpful for increasing her circulation because she had a bad wing and a bad driver's side rear. So she had some challenges getting around. So keeping the circulation going was really going to be tough for her. So massage can really help with that. Heat therapy. I don't advise using like the beanbag things, you throw in the microwave, especially this time of year. Primarily because if you have a dog that is that challenged in moving, you don't want something on them that can cause a burn. So what I usually recommend is a fleece. Let the dog's own body heat create the heat around the joint. That can be helpful. There also, depending on where, if this is a joint issue, where the joint pain is, we can look. There are things called hot socks or carpal socks, which are kind of like neoprene. There are some that have a ceramic sewn into the material, so it reflects the dog's heat back into the joint. Those can be really helpful. So again, depends on what we're looking for. The heat therapy can be great. Comfortable surfaces for your dog is also going to be important. I don't encourage you to run out and buy a new bed. Anyone who's ever dropped a couple $100 on a brand new bed that their dog won't sleep in, there you go. That's number one. But if they are open to new bed experiences, then I would say orthopedic, but the solid foam, not the chunks. The chunks tend to make them work a little harder. So if they've got some joint instability or joint pain, that's going to be tough to get out of. So you're going to want to avoid that. Okay, so needless to say, I'm a big swimming fan. And if you wonder why it's so humid in here, there's 10,000 gallons of water right behind you. I love swimming. I use swimming a lot for all of the dogs that come in, but a lot for the valley fever patients. Primarily, bless you, because it's going to take the pressure off the joints. It is almost a completely non-weight bearing exercise. It's great for dogs who are deconditioned or out of shape, and especially good for overweight dogs. It helps burn some calories, but without the pounding and without the compensation that comes from trying to avoid bearing weight on a limb that is uncomfortable. Water itself is, I think, incredibly powerful. Even just the hydrostatic pressure that comes from water. So if you think about, I have to admit, once or twice in 10 years, we have had to go in. We've had a code brown in the pool. So we have had to go and save some things. But if you put a bag over your arm and you put it in water, all of a sudden you go, you feel that. That's the hydrostatic pressure. So that's going to be flushing all of that fluid, moving it, getting things out of the way. So just the pressure of being in the water is great for these dogs. It builds fantastic confidence. I like to think of water as salt. Does anybody bake? Who in here bakes? Okay, all right. So believe it or not, to make a really, really good chocolate brownie, you have to put salt in it. If you don't put salt in it, the chocolate doesn't pop, right? You don't get it. So water to me is the same way. We can do by adding something that they're not a fish, they're not going to swim for their ADLs, but by being able to practice and moving their limbs through the water, feel comfortable that they can get from one end to the other and not drown and not panic, moving through a fuller range of motion, they start to feel like they can try to do other things, right? So that all that we've talked about, all the rough part about not moving, that all goes away in the water. It all goes away in the water. So what we see, and this happens a lot, we'll have someone come in who maybe had only come to see us a couple of times, but they had to miss a week, and they come in and they'll say, oh, I can really tell that Joe didn't swim. He was a little more careful. He got stiff, a couple of days after we should have been here. So you start to, you really start to notice those benefits. Now, I will say that water is not for everyone. So you do have to consider who is it ideal for. So we've got the joint dogs, the overweight dogs, the painful dogs, but we've got open wounds or draining tracts. You might know what a draining tract is. Okay. Draining tracts, that's a no. No for the water. We don't need to be introducing more nastiness that the immune system has to fight. Severe respiratory distress, let's not put your dog in the water if they can barely breathe standing still. Let's not put them in the water and really make them struggle. They're afraid of water. Not every dog knows how to swim. Not every dog loves to swim. We've seen Goldens, Labs, Pits that we could not get off the wall. They would not go anywhere near the water. So you have to be mindful. Again, we're back on that emotional piece and understanding of what they want. And also if you have any neurologic instability. So Dr. Shubitz showed us a couple of the one with the big wolfhound. Yes, with the spinal cord. So if there's movement in there.
Yeah, she wasn't that bad.
She wasn't that bad. Okay. So if you have
she might not be able to.
Maybe, but the water would still benefit there. So my point here is that if you've got some instability in the bone, if you've got instability in the vertebrae that could potentially go and impact the spine, then we want to stay away from the water. But that's something that we would talk to you about. I would get with your referring veterinarian just to make sure that everything was safe. And speaking of safe and fun, that's the other piece to swimming, is we have to make both of those things true. So life jackets, we do life jackets with probably 95% of the dogs we swim with here. It just makes sense. Water temperature. How many of you have a pool at home? Okay. Pools around here in the summer can get really warm, like upwards of 90 degrees, depending on how deep the water is. We keep ours at about 84. So 84 is comfortable, but if you start, really swimming and working, you're not going to overheat. Once you get above that, you get to the point where you can't get a break. You can't cool off. The water is no longer refreshing. It's just too hot. So be mindful about that. And you also don't want it too cold. I know we've had labs that will swim in, oh God, Piggy's water was probably 55 degrees, 50 degrees. The labs are like, yeah, that's good. Well, not all of them are going to be able to handle that. So be mindful of what they can and what they can tolerate. And I think the other two important things are to just start slow. Know what they can handle, and also know their signs of when they're getting tired. I think one of the big signs is going to be their tongue is going to be a big giveaway. So kind of hanging out, not too bad, enjoying it. Once it starts getting long and flattening out, that dog is really starting to get overworked and overheated. So you want to get to it before it gets really flattened out, okay? You know when your dog gets tired. You've seen it. So just make sure that you're paying attention to that. All right, we're almost done here. We've just got one more slide to go through. Couple of things about the pacing and back to the fatigue. Fatigue is such a common element of valley fever that I think it's important to understand that it's hard to see. You know, it's not like a limp. You can't say, oh, I have a limp because, you know, he has valley fever in his bone. Fatigue is very hard. It's very hard for us to recognize. It's very hard for us as owners to understand why the dog doesn't want to do something, go for a walk, play with the ball, engage with us. So practice reading your dog's signals. You know, what's normal panting, what's willing to rest, you know, and what's I'm only doing this because you asked me to, and I love you, and I'm going to do everything I can, but man, I'm getting tired. So knowing the difference between those and the difference between being sore. What's being sore, what's tired, and what's really unmotivated. And the unmotivated really comes from that fatigue, please. And that could be, you know, I'm just interested in doing the exercise that you're asking me to do. I'm looking away from you a lot because I don't want to do this. Looking for the exits, looking to escape, things like that. And there's a reason we shut the gate on the deck of the hotel. I'm kidding. And use your good days wisely. I mean, we all experience this. You have days where you feel like you can conquer the world, and you have other days where, man, you use up all your spoons just getting out of bed and taking a shower. So on those good days, don't try to make up for the bad days. Okay, keep it. Don't try. Consistency is much better than intensity. Okay. Regular, gentle exercise is going to get you a whole lot further than sporadic, intense exercise. Rest and recovery. Sleeping is really, really important. That's when your body heals. That's when your brain heals. That's when you get to reset. It's true for your dog as well. Knowing what kind of dog you have in front of you. So I have 2 dogs with valley fever. I have Andy, who is my greyhound wannabe, and I have Helen, who happens to be 15, and she is a very, very low titer. So I know Helen can be much more active than Andy. So I'm going to be looking for dogs that are higher energy. They're going to need more mental stimulation. That's where canine enrichment activities come in that may be related to food. It could be we have a game that we put together that's to do with muffin tins. So you take a muffin tin, put a smelly treat in each of the muffin tin holes, you cover it with a ball, a stuffy, a towel, rolled up socks, anything that they have to move to be able to get that out of the way. So if you have a dog who really is focused on the hunt, they need something to do, you need to find a way to keep them active that doesn't compromise whatever is happening in the body. Senior dogs, you really want to stay focused on maintaining their mobility. So that's going to be, you know, doing your exercise as fun. Those are things you can do on your walk. Overweight dogs, I really love swimming for overweight dogs. You can do it. You don't have to have the food element. It's just, it feels good to be in the water. And then making it fun, you know, treats, love, affection, toys, whatever your dog reacts to, that's where you go. And keeping your sessions, this is really important. Keep your sessions short and simple and sweet. Trying to work with your dog for more than somewhere between 10 and 15 minutes is probably going to be too much, depending on your dog's energy level. That's what you're going to get with good technique, not encouraging them to compensate, so really you're not working the muscles that you want to. It's about all they can pay attention for. And a lot of my clients, I'll start with 5 minutes. Just need 5 minutes of exercise, that's it. And it's easy for you guys to do too. I mean, if I say, oh, you've got to work out with your dog for a half an hour every day, I would look back at you and say, I can barely work out myself. a half an hour day. So we'll see how that goes. But 5 minutes, and maybe it's around a mealtime. You'll find the spaces on what works. Okay, so what do we want you to know? We want you to know that exercise aids recovery. Every dog is different. So what works for my dog is not necessarily what works for your dog. Consistency, not intensity. Okay, it's going to beat it every time. Make it fun. And this one, this is the soapbox I will stand on all the time. Be your animal's best advocate. Take your notes, go in, be prepared, be organized, be able to say, okay, here's what I saw. Here are my notes. I'm happy to go through these with you. And if your vet doesn't say, thank you very much, I want to give you the world's biggest hug, you want to ask why. Because this is your information. This is the key. This is what they need to know. Okay. Lisa, did you have anything before we get into questions and answers? No. Nope. Okay. All right. Come on up. Who's got questions? All right. All right. Well, we've got some online, and then we've got some in the audience. Let's start with Dr. Brad.
Mine is a PSA of public service.
Okay.
That goes along with what you just said about. Lisa and I have Shubitz and I both know that unless your dog is vomiting and having diarrhea, value fever is always on our control. So when you walk in the room with a sick dog, you've maybe already filled out something online, history, that we ask you to do, and then the tech comes in and it starts asking you the same questions, and you're like, I'm just going to wait for the doctor. One of the hardest things in medicine is getting with the history. And so for people who are willing to come in and go through all those steps, you'll find that the third or fourth time somebody asks you something, you're like,
Here's my paper.
So always be patient, but this being prepared, I just take that people from you. You can't say enough about that. This is a team, not fence.
Fantastic. Thank you. All right. Who else had a question?
I have a couple of questions. I'll make them short. I have a girl that has, she's 9. She has valley fever. She has very low titer. She had the pneumonia, the flu, and all in the lungs. So she's on prednisone titrating down. I watch her. Her breathing moves so fast, which is what made me first take her in. Her breathing's wonderful now. It's really helped. So my question is, being on the itraconazole and a clindamycin and a prednisone, those two are titrating off. Should I expect the fluid to be gone? Because she loves to go for walks. We walk at 5:30 in the morning and 7:30, and I hate it because it's so hot.
Data driven. If you want to know if it's gone, go get an X-ray.
I've got 2 different sets.
Is it gone?
Oh, well, we're going to do another one, but that's the best thing to do to see if the fluid is gone.
For sure.
And about the heat, I'm not from here. I've been here for years. I have 6 dogs. We all go for a walk at 5:30 in the morning. I hate getting up there. But anyway, with the heat here, they can't go, they literally can't go outside from about 11 to 4. We just spread the papers. Yep. So you look around and especially watching the sick dog who's not acting sick at all, except for eating and hunger, drinking. But I think, oh gosh, she's just like, I wonder if she's okay. And I look around, all 5 of the others. They're all. So I mean, I guess that's just Susan and
So it is, and some of these things that have been discussed can help address that.
Absolutely.
Mental games can help dogs that are stuck in the house
Yes.
a lot. Playing tricks. I don't know, hide food in little dishes all over your house and let them get them one at a time. We play a game where they all have to sit and they're all trained to fetch a toy and trade it for a cookie. We take turns. You go get that. Bring it back. You get your cookie. Go sit down. Okay, your turn. Go get that. Come here, get the cookie. You go sit down. Bird dog gets to go get it. So, I mean, what you can do with your dog in terms of mental games that really helps stuck in the house. house and can't walk, because my dogs are in the same boat, is
Yes,
the mental stimulation help, and then these exercises, these simple exercises
Yeah.
with, I have way too much junk in my house, but I mean, literally a disc and a fit bone or one of these exercise steppers. So some of this is stuff people already probably have around their house already. Play games with them, teach them tricks. I mean, these are physical, high five, you're stretching.
Yeah.
Give me 10,
That's
you know,
a great idea.
high five. Oh, you got a shoulder stretch going on. Sit, stand, you're building up the hips, you're using these muscles back here. So you can do a lot of things in the house in the face of our horrendous temperature-related
It's just
limitations. I don't like getting up at 5 and walking dogs either, but it's that or they don't get it at all, and neither do I.
You have to do
You know,
Yeah, and understand that exercise, this is eventually a book title, so don't steal it. Exercise is more than a walk in the park.
it.
Okay, so there's a lot that you can do. There are a lot of things you can do once you start to open up what those options are. Even with 6 dogs, you can do it. All right, who else had a question?
I also walk my dogs first thing in the morning. Now, my dog that has valley fever, she's actually off all meds now, and she's got good energy. But I do, on occasion, see her towards the end of our walks, where her hind leg, when she's standing, will be shaking a little bit. Is that something to be really concerned about? Because it only happens when she's standing, and then she gets home and she's fine.
well, as a veterinarian, I think of a couple things. She might have a bad hip, especially if she's older.
She
She
has
might
a-
have some
She has a
arthritis.
slipping.
She's a bad knee.
Yeah.
Okay, so she needs some of this light range of motion massage that Kate talked about might help her. If it were to become progressive, you might consider follow-up X-rays to make sure valley fever doesn't come back, because it has a bad, nasty habit of doing that. And that there's not other orthopedic pain. And also, are the muscles starting to atrophy? Because with age, it's really hard to keep
Yeah,
all
she's-
atrophy from happening anyways. And it loosens their joints and makes them more prone to wear and tear.
Will you please repeat the questions because people
Sure.
online can't.
Can't hear it. Okay, yeah, Eden,
So Lomahy.
Yep.
Little Chinese.
okay,
He's my cricket player.
yeah,
He has the version of valley fever in his lungs.
Okay.
And he's been really good for the last 6 months. And he doesn't have, I mean, he acts like he feels normal. Since it's that version of it, odds are good it's not going to like Achilles and
disseminate.
Yeah.
So the question is, McGee, Chewini, feet like this. Eden's asking about the possibility of a lung infection disseminating to other parts of the body.
So in general, if they've had a good, this is sweeping terms. So typically, if they've had the disease limited to their lungs, they've responded well, they're healed and they're off medication. Most dogs do not disseminate because they're off medication. If they have some immune system defect that we can't identify that's associated with the kinds of cells in the dog's body that keep the disease under control, if they lack that, or they put on steroids or something really immunosuppressive, then the risk of dissemination is much higher. But we actually don't have a way to identify who's susceptible to dissemination after recovery.
because, we know we're looking at arthritis in this.
But that doesn't make him susceptible to dissemination. This is an immunological event, if you will.
Catherine, did you have questions from online?
Yes, I have 3.
Okay.
Have you ever seen rhythmic twitching or myoclonus present with osteomyelitis?
Usually in the brain. It's usually set. So the question is, do we see myoclonic twitching? What was it?
The osteomyelitis is in the jaw, but have you seen rhythmic twitching or myoclonus present with the osteomyelitis?
No, not unless it's also in the central nervous system. I would expect there's probably some kind of inflammation also in the brain, and if it's in the jaw, there may be also some lesions in the skull, and if they go all the way through, you can have inflammation around the brain. But even just may have a small brain lesion that would only be detected by an MRI, and you're treating everything, so it's not necessary unless the central nervous system signs progress. There's no reason to pursue advanced imaging. The disease is already being treated.
What type of tests do you need to take to assess whether or not valley fever has migrated to the brain or spinal cord?
Advanced imaging, CT or MRI. So what kind of test do you need to determine whether valley fever has moved to the central nervous system or brain? And that usually entails doing a CT scan, or if you're looking in the brain specifically and not at the spinal cord, an MRI is usually the best procedure to look at that. It looks very deeply at the soft tissues of the central nervous system.
Okay, and then when is amputation the best plan for a dog with lesions in the elbow?
That's a case-by-case basis where I would go in.
Yeah, I have one right now that needs amputation that the owner is really reluctant to amputate. But the joint is completely destroyed, and he has recurrent disease in the elbow. That would be grounds for amputation. A dog that's in constant pain and there's no way to relieve the joint, surgical options such as fusion, arthrodesis of the joint is not an option. Amputation would be done for two reasons. One, to make the dog comfortable because the pain is unremitting regardless of what kind of medication it's on. Or the disease is unremitting and it is a source of chronic infection and you need to debulk the disease because after that it would be really simple to get the dog over the valley fever.
So you basically cut it out by taking
Yes.
the disease. Okay, hold on. Let me get someone that has an asthma. Yeah, go ahead.
Okay, so, I have an 11-year-old Labrador, she just turned 11 in June. In, January, she got diagnosed with oral melanoma. So we went to, Dr. McNeil on Furtwell. We ended up, they did chest x-rays to make sure it wasn't metastasizing. And what they found, the second series was some nodules on her lungs. I opted to do the vaccines, which we're doing before shot series. So, about 4 months ago, my regular vet thought she also had cold. So we came to Kate and we do a series of exercises and different things. So about a month ago, she had started digging in the backyard. I'm sorry, it's a little complicated. So I told my vet, can we run a valley fever titer? And it turned out on the first one, it wasn't positive, but the oncologist said let's run a test, which they did, send it to a different lab, and it was positive. So I guess it's a fairly low titer, but just looking at the slides and listening to you, it sounds like it's a little confusing. Like she was really panting, and I thought all of this was the cold and some hind leg weakness which we're working on. But she's been on the fluconazole for like 3 or 4 weeks, and the panting's going down. The last chest X-ray they did was they didn't see anything in the lung. So I guess, sorry for all the comments, but I guess is it confusing to look at gulp and then some of the valley fever symptoms in terms of the lungs and panting and other kinds of things like that?
Yeah, that's a hard question to answer. That's a kind of a case by case.
Yeah, that's pretty good. So 11-year-old lab, gulp, geriatric onset laryngeal paralysis, oral melanoma, did 2 valley fever tests. One came back negative, the other came back with a low titer. The question is about what's the overlap between seeing gulp, the oral melanoma, and valley fever.
And the fact that the dog feels better off.
Yes.
So that is a very difficult That's very difficult to answer because it's very difficult to prove that dog has clinically important valley fever if you can't find it anywhere, the titer's low, but there's been a change, the dog doesn't feel well, the dog's improved on fluconazole. I mean, one way you can test that is take away the fluconazole and see if the symptoms come back because he hasn't been on it very long. But I guess you can assume the dog has some probably relatively low grade form of valley fever because the disease is ultra common here. It's the right time of the year. I don't know if there's a wrong time of the year for it.
But it's also.
But we see big spikes in the fall and in the early part of the summer before the monsoon comes. We see like a really big spike in cases.
So asking with that, mentioning the low titer, we did have a question that came in prior that was asking about, does a 1 to 2 titer, does that indicate ongoing infection or is that exposure?
So that is a question that gets asked a lot. It gets asked by veterinarians, it gets asked by dog owners. And I've done this research twice now, once in the early 2000s and once again about 10 years ago when we were trying to develop the dog T-cell assay. And that is that the rate of dogs walking around Tucson that are completely normal with a titer, usually less than 1 to 8. So they're mostly 1 to 2 and 1 to 4, is about 20%. So 20% of dogs have a titer. And in the study we did on puppies, these dogs popped the titer and never got sick. I mean, there was no sickness. They popped the titer and it went down. And we followed 124 of them for 2 years, up to 2 years. People didn't stop coming back every 6 months until we literally closed the study. They only had to come in for a year. So, but they just kept coming back. It was really cool. People are awesome about participating. So it's very hard to say that a dog that's like particularly asymptomatic if the symptoms are vague and they have a 1 to 2 titer, whether that is valley fever or not. Whether it's valley fever, the disease or not. Are they infected? Yes, but about 70% of dogs will become infected and not get sick. They'll clear it on their own. And this is true of humans as well. And then the other thing that's difficult in that is another 13 or 14 or 15 or maybe even 20% of dogs have valley fever. Everything looks like valley fever, and they do not have a positive test. So it's all very muddy at the bottom. Okay, and it's hard to use them to diagnose disease, to follow up disease, and or you know, when their titers are really low, or even dogs that are sick that have negative titers. So titers are difficult. If your dog is responding to fluconazole, I would continue to work with your veterinarian with the presumption that she has developed an illness related that's valley fever, and that it's probably, the prognosis is probably great to have it just go away. She may need medication for a while. She'll probably be fine. She's been through a lot of stress with her conditions.
But the hacking and the coughing and the panting, that has really not gotten a whole lot better.
It sounds like it's probably real.
Yeah.
You know, and the fact that she had a tiger caused them to put her on fluconazole, it might have gone on longer.
Okay, so we'll take one more question and then I'm gonna ask a question from, okay, go ahead.
When the dogs are tired, you have the first tongue that hangs out, and then later the long flat. Can I see that?
You can, so. Right, so just kind of out, just a normal pant. And then as they get more tired, the tongue comes out further, right? So good. And then the last one is it comes way out and it flattens out. So if you think about what the tongue does, one of the tongue's role is for heat dispersing, right? So cooling. So the bigger the surface, the more they can cool. So when it comes out and it's big and flat, that dog needs a break. And it's especially important to know here in Tucson.
Flat means hanging down.
Flat means like, you know, so when you're looking at So when you look at a dog, normally, you know, it comes out like ours, it kind of comes out to a point. When they get really hot, it comes out and it is flat.
So it hangs over their teeth.
Hang over.
It looks really round
It looks like this.
on the, it looks like you smashed it between, you know, two pieces of something.
Okay.
It's real flat.
Last question.
Last one. Tiger was 1.2. Fast breathing. Glucose and all. Didn't help for 4 weeks. Emergency room because of really fast breathing. The prednisone, she's great now. Is it possible that she doesn't have valley fever? No, just
I doubt it. I doubt it. There aren't that many causes of pleural effusion, fluid around
that's
the
what
lungs.
she has, yeah.
Besides valley fever or some other infection, but the fact that this dog's responded to antifungal medication to me is diagnostics, regardless of how
Do you
big.
think if she
the
had
titer-
just, if we had just added prednisone to the glucosinol, is it very possible it would have gone away as well? Or would you think
Prednisone can mask for the reasons that I discussed why we use it. We decrease inflammation
right?
in ways that are necessary, but it's masking the disease. You still have the disease doing whatever it's doing there. So if they had given her only prednisone because they didn't think she had valley fever, she might have felt better for a while, but in the end, she would have been more and more sick because they suppressed her immune system. You didn't know what was going on.
Okay.
And the fungus is having a heyday inside the dog, and now it's maybe, places besides the lung. And my own dog that had a pleural effusion back in 1997 had no titer until, we had been looking for the disease for a month. Couldn't find it. Her blood work was normal. Her titer was negative. Finally, she popped the titer. 1 to 8. That's as high as it ever got. She responded very poorly to fluconazole. Her titer went down, but everything else didn't change. She continued to have pleural effusion. So she's got a 1 to 2, and she's croaking from this disease in spite of the medication. And we treated her with an intravenous drug that made her well. But this is another example of low confusing titers and how they don't tell you what's going on. Right? You and your vet, the diagnostics that are available, and I realize all of this is going cha-ching. It helps to sort out the valley fever in terms of the diagnosis. It's what helps to sort out the valley fever. And this could apply to anybody in this room who's got a dog with valley fever that doesn't walk in, with a giant bone lesion and a titer of 164. Low titers are difficult. They cost owners more money because it takes additional diagnostics and potentially more trips to the vet to try to understand that this is the cause of the disease.
I figured it was the cause.
And I would say that vets in Arizona are more astute than anywhere else in the world with this disease. But it is a very bad disease that can be difficult to diagnose. And it can be hard. And it runs into some dollars. We need that.
Speaking of, actually, we're way over time. So let me ask one question, 2 sentences. This is the question that gets asked every time. Where are we on the vaccine?
Thank you.
The vaccine is this close and this far away. We're still in regulatory. It is making progress. And I feel like we can almost use it, but we can't use it without the permission of the USDA and the licensing. But I think it's going to make it to the finish line. I just cannot tell you when. And every time I see a new dog with valley fever, it's like we couldn't prevent it.
Well, thank you.
Thank you
for that info. And we're going to. Don't forget your